I would like to welcome you to our first webinar to explore the MSc Master course that we are developing in partnership with London Metropolitan University, as well as we will be introducing to you the Center of Excellence for Technology Enhanced Care. First of all, I would like to outline that I'll be using the term assistive technology as an umbrella term, which will explore the issues of telehealth, telecare, assistive devices, mHealth, telemedicine, iHealth, and eHealth, and electronic patient records. So just only to be aware in case I'm using different terminologies within the presentation. As you know, that the NHS is facing huge challenges these days, and the social care as well, with the industry of technology industry, in terms of facing the challenges that the NHS is actually facing in terms of shortfalls of funds, aging population, and rapid changes within the workforce. And that's really putting a huge pressure on the NHS and the care providers and the technology developers in terms of meeting the needs of individuals. Therefore, the development of assistive technology is expected to be of a huge importance in terms of providing a strong platform that will connect the care providers with the with the technology developers, with the end users in terms of patients, or with the professionals who actually will be using this technology. The literature has shown that assistive technology is transforming health and social care. It's making a huge difference to the way that we are delivering care, in particular in these times, in terms of it is enabling the professionals to faster diagnosis, better treatment of illnesses, and through the in terms of artificial intelligence and following the patient's behavior and the client's behavior within the home environment, as well as supporting in terms of improvement of care, improvement of patient care, and also making healthcare more efficient and more structured. As you know, there's advances in science and technology in terms of transforming healthcare and medicine, giving patients more control in their own health. And there is more opportunities for the use of mobile technology within healthcare, and particularly the use of app and the use of particular software or system that will manage individuals with long-term condition. Now, we developed within Barnet and Southgate College for the last couple of years or 3 years, we developed the Center of Excellence for Technology Enhanced Care, and really with the key functions of educating the manpower, educating the workforce in terms of raising awareness about the use of technology, the implication of technology in health and social care, as well as allowing them the opportunity to explore the technology in terms of the real life and to be engaged with it in real terms through the use of the living lab, which has become more of a physical environment for showcasing and demonstrating and developing new technologies. And part of the function of CETIC has been consultancy in terms of working with the private sector and with the public sector in terms of engage in the service redesign and integrating technology in the patient care pathways at the right time in the right environment, and to ensure a quality of care is being delivered. Furthermore, CETIC has been involved in the research evaluation or evaluation of technology impact within the social care and healthcare, and basically examining the impact of technology, examining the patient experience or the client experience using this technology, as well as the experience of their relatives, and trying to establish guidelines and protocols to support implementation of technology within health and social care. Again, the Living Lab facility is a testing hub for technology, for demonstrating the new technologies. And again, that the Living Lab will play a major role and a unique role within the master degree that we are developing, which I'll be explaining later on, in terms of testing new technologies that could be developed by, or new product that could be developed by our master students in the coming year. The aim of assistive technology, the aim of the master degree is really try to develop the skills and the knowledge of the students, really enhance their skills and their practical skills through offering them scenarios that would explore particular patient conditions, will explore patient problems and client problems within the home environment, as well as supporting, developing the skill to support the professionals to integrate technology within the care pathways for these individuals. And again, it's really looking at ways of how we can develop these transferable skills for our students to integrate it within the health and social care, within industry, and really build up their skills within the area of technology. And again, that really would be looking through developing the skills also for the students and the knowledge of the students, and also develop their skills of critical analysis and critical review of the current products within the market, and how that could be either used, utilized, or could be developed to enhance the experience of patients and their relatives and the clients. Now, the structure of our master course, as you probably know, is going to be over 180 academic credits. And that really is going to have two elements into it, or three elements into the master degree. You would have core modules, and these core modules would explore the concepts of research methodology, develop your ability to develop your skills within research in terms of literature review, data collection, data analysis, data reviewing, report writing, and also, and that could be all utilized within your academic performance or academic writing skills that will enhance your dissemination of your knowledge and your skills across the board to professionals or to publication or for discussions within your own business. And again, we're going to be looking at more particular elements in terms of assistive technology into social care, in terms of telecare, how we can maintain safe environment for these individuals, how we can understand and interpret their activities and their behavior within the home environment. So for us to understand their behavior and the impact of their behavior into their health and their care provision and so on, as well as we'll be looking at ways of how we can enhance the skills of our students to understand long-term conditions, how we can look at existing maybe systems and develop a new system that will address their needs, things like dementia, things like chronic heart failure, chronic obstructive airway disease, looking at ways of wearable sensors and biosensors that could understand and interpret the client's or the patient's condition for healthcare professionals to interpret that knowledge and these findings for better management. As well as we're going to be looking at more of accessible design in terms of really designing specific systems or specific devices that could add value, could add quality to the client and to their relatives, as well as adding a value to their quality of life. Now, for these modules, there are 30 academic credit modules. You can choose 2 modules out of what's been outlined here: research methodology, assistive technology in health and social care practice, assistive technology in long-term conditions, or assistive technology in terms of accessible design. And really, so you need to select 2 modules from there, and that will give you 60 credit with optional modules that I'll be exploring shortly. That also will give you can select another 2 modules from these modules that give you another 60 credit, with the final project of 60 credit. That'll give you in total 180 academic credit. Now, some of these optional modules, if we look at current practice, we are changing it. We're bringing new practices. We're using technology. We're moving away from technology being as a fantasy of a method of the way that we deliver care, to becoming more of a practical and becoming a critical and crucial way of delivering care and assessing the patient or assessing the client from a distance. And we're reading more and more literature, more and more research, and particularly these days, how we're utilizing technology to follow the clients or to follow patients within their home environment and offering them the medical advice and the medical assessment they require. particularly for patients with long-term conditions. Again, these modules would be, you have to select 2 out of these. And again, the use of technology with really bring with it legal and ethical implication is how we want to develop the knowledge and the skills of these individuals, students, to really underpin any legal and ethical issue that might face them during the implementation of their technology within their clients. Now, for some reason, some students will start their program maybe halfway through it. Their circumstances changes, and their their requirements might be changed in terms of academia or in terms of personal life, etc. Now, there's an exit strategy. So, if you want to only achieve a postgraduate diploma in assistive technology, then you have to do only 180 credit without the project. Or if you want to have a postgraduate certificate, you only have to have only 60 credits, which could be 2 modules, either their core or they are optional modules, or one optional and one core and 1 optional module. Again, we are aiming to validate this program to start September 2021. And again, we're going to be having more further webinars to explain this more in detail. Now, who should really be applying for this master degree? It's open for individuals who have experience within healthcare, within social care, and also medical staff could apply for it. Allied healthcare professionals, physiotherapists, occupational therapists, speech and language therapists, dietitians, psychologists, technology developers, technology designers, technology installers or implementers who want to know more about the system and the impact of that technology, or want to explore the designing of clear pathways for these individuals. And again, that could be also applied for individuals from the private and the public sector who is delivering care or engaging within care development, as well as for students from computer or science or software developers, and also engineers who is engaged in product design or accessible product design for these individuals. It is a part-time course, and therefore it's going to be delivered at 1 day a week for 2 years. That really will give especially staff who is in, or students who is in full-time employment, or that will give them the opportunity to continue being with their employment, as well as just being released for 1 day, or some of the material could be developed to be delivered online in terms of webinars and seminars, discussions, and that allow them to do it either from the home environment or from their workplace. If you are aiming to deliver this in September, so we're really looking forward to receive application forms by August 2021 for us to be able to review, be able to explore the possibilities of securing scholarship either through postgraduate bodies or sector, or also from baby sponsors from some sort of private companies or from the NHS and so on. The cost of the course would be £9,500 for the two years. So what are the entry requirements for the actual degree course? We are looking for individuals who is having a BSc or BA honors degree with 2.2 class. Also looking for students who is having experience within health or social care, as I mentioned earlier on, allied healthcare professionals, computer science or computer programming, engineering, product design, commissioners that who work within health and social care, who's responsible for commissioning some of these technologies or some of these systems and products, as well as and again, really some of these skills may be not essential, but at least that will give us an insight into the type of students that we is being recruited for this type of degree. And again, quite important that we look at individuals with English language proficiency in terms of critical writing and critical analysis of the literature reviews and so on, and be able to submit their assignments as well. Part of the application process is we would like to see personal details of the individual in terms of their education and their employment up to date, looking at their personal statement and clearly stating is the reasons why they want to join the course, why they want to be engaged with it, and what sort of their personal and professional ambitions that the course would actually develop within them in order to move forward within their career or within their professional life. As well as we're looking at outlining their academic and professional backgrounds, and really to demonstrate to us their ability to to study and function within that postgraduate level. And again, we are going to be looking at 2 original academic references to support the information that's being provided, as well as looking at the academic scripts for their previous academic studies and their degrees. Also, once the students are able to complete the course and to finish the course, what sort of skills that is going to really open for them more opportunities that's going to open for them within the world of assistive technology, is that could allow them employment within the private sector and the public sector, with the NHS, with social care provision in terms of councils or boroughs, looking at working with industry and technology developers, or they could be looking at starting their own small, medium enterprise businesses or startup businesses within the area of assistive technology. Because some of the modules element is looking at business and commercial side of business development of that technology within health and social care, as well as maybe the knowledge and the skills that you gain will allow you to develop consultancy skills, and you become more clearly engaged and involved as a consultant for particular industry, particular trust, particular council in developing new systems or testing new systems or integrating technology and redesigning of care pathways. Again, this master degree is offering you critical, really further skills, transferable skills, which you could apply it for researcher post, or you could apply it even further for continuing further studies into doing your doctorate studies or PhD. Things like, you're going to be developing your critical thinking, you're going to be developing your creativity and innovation ideas within assistive technology. You could become a visionary and within the assistive technology, applying of your analysis skills and your appraisal skills, that also your skills of project management, problem solving, and also with personal leadership and project management. If you are requiring further information, you could contact me directly, either via email or via my mobile number, or you can visit our webpage that we're creating specifically for this course. Again, I think one of the distinctive for this master degree that is really provide the students with the required knowledge and the skills to become visionary and within an assistive technologist, that they could apply these skills to provide them with a fast track into career within the health and social care. Particularly now, the NHS is developing particular, organizations or service delivery like the NHSX and others. And really, they're purely looking for individuals with these skills that they could apply for, particularly for research and for evaluation skills. And finally, I would like to state that the students within this master degree is they would allow them to develop their capability, develop their capacity, whether that from knowledge or skills that they could apply with them within their future workplace to enhance the quality of care and to enhance the quality of system that's being developed to ensure that these individuals are safe within their own home environment. Thank you. And I wonder if there's any questions there. I'm quite happy to answer them, please. A question from Mark Phillips asking about what facilities are there in Southgate campus. We have the living lab, which is basically is a state-of-the-art facility that showcasing technology and demonstrating technology, how technology is will enhance the quality of life for these individuals in the home environment, as well as another question is, do I have a degree to take this course? Yes, you need to have a degree, a BA, as I mentioned earlier on, you could have a degree, which is BA or BSc in the areas that has been identified, in either in computing or in health and social care or allied health professionals, etc. The living lab facility within Southgate is quite a unique facility. As I mentioned, it will allow the students to actually utilize their skills in development of a new system, new technology that could be tested within the living lab. We could be tested on clients who could be individuals with learning disabilities or with physical disabilities. I'm a web developer. Can the course help me advance my skills? Of course, if you can utilize your web developing skills into developing systems that could be related to health and social care, definitely that could be an opportunity for you to integrate and to become more involved in that in this master degree. Definitely. Any further questions or clarifications needed?
Hi, Firas. We have one question within the chat window.
Sorry. Okay, there's another question from Diane. And Diana, she's asking for, does industry experience count towards the entry requirements NTS, and can the course be delivered remotely as travel to? Okay, this is absolutely definitely this could be it's doable, and we can work together in developing it, as I mentioned, either remotely or through the use of webinars and online material that could enhance some of the distant learning students. Absolutely fine. That it's doable, definitely doable. Another question from Alison. Can you tell me more about scholarship opportunities? Yes, we're going to be negotiating with some industries to see whether they can contribute for the cost of the actual course, whether that will be a partial scholarship or a full scholarship, or we can look at some trusts in terms of like the Wellcome Trust or the Innovate UK or see the Southeast Health Alliance for Technology, UK Telehealth, or BA Consulting, private industries, or other industries or other private companies could be involved in supporting some of our students undertaking this course. I hope this, Alison, answered your question. I'm happy to discuss that with you further. Thank you, Diane. Any further questions, please, or comments? Thank you, Alison. It's all gone quiet. I assume it's all now no more clarification or one new message. Please, as I mentioned in my last slide, is my email address and my telephone number and the web page that we created for the web for the course itself. Please visit this and contact me. I'm more than happy to answer your questions, and I would like to thank you for joining the webinar. And thank you very much for your time.